Hello, everyone. I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And in this segment, I'm going to be going over a obstetric emergency or obstetric complication of pregnancy, and that's known as the vesico-vaginal fistula or obstetric fistula. So the World Health Organization goal was to completely eliminate this condition, but it hasn't gone yet. However, the good news is that this has decreased in rate and um, in the amount that has taken place. So this is basically the reason that this is such a important aspect to look at is that this causes urinary incontinence, and so when the baby is pressing against the pelvic floor, pelvic bone, then this causes obstetric fistula. So, just to take a look, a research team this is where I went for my global health degree. The Bloomberg School of Public Health, Saifuddin Ahmed, he's a professor in the population, family, and reproductive health. He conducted an analysis of the fistula in 55 low and middle income countries. Um, they estimated that still that's a substantial amount, 457,000 women ages 18 to 64 and roughly 388,000 women were living with obstetric fistula in 2020. Of course, this is much lower than the 2 million that lived with obstetric fistula. And so the initial estimate was, according to something in the 1990s. So that's when the last analysis was made about how many. Um, so the study is thought to be the first of its kind to use statistical modeling to generate a more accurate prevalence rate. Um, so there's really a lot of progress that's been made. The reason I'm making this video is because I wanted to shed light into this terrible condition that takes place. And there's a lot of stigma that goes on. And I had studied this in Hopkins as to when people have urinary incontinence that might lead to not being able to get married or certain things. Um, so basically, kind of what I explained to you, prolonged obstructive labor that goes untreated may lead to obstetric fistulas. This is all largely preventable, including skilled birth attendants. And this is community health workers can bridge the gap for primary care providers that are often um, stretched thin for the number of um, individuals that they serve. So community health workers and birth attendants can take over there. So the reason I'm presenting this is twofold. I want to shed light on the condition of obstetric fistula, but also how there's a shortage in physicians in these areas. Um, so this was all done by demographic and health survey, which I've used previously to research on HIV. Um, so the researchers adjusted for misclassification using results from two large population-based validation studies in Bangladesh and Ethiopia. Um, so sub-Saharan Africa, this is interesting, had nearly twice the prevalence rate of Asia, about 71 cases per 100,000 women compared with 36 per 100,000. So the interesting thing is that even though in the world there might be a decrease in vesico-vaginal fistulas, but this may not be the same in certain regions of the world. And that's why global health is so challenging, is because there's a lot of different components to be understood. Um, so half a million women living with obstetric fistula represents an enormous unmet need for surgical treatment, social integration, and long term care. Um, so, like I said, there's a lot more to be done, but there's a decrease in vesico-vaginal fistula. I hope this has made some sense. Thank you for listening.